All right, everyone get ready because today we're going deep on a case study that's got a lot going on. We've got some clinical findings for a patient and an expert here to help us unpack it all. Think you can crack the case.
Well, I love a good challenge, and this one sounds like it's going to be interesting for sure.
I think so too. So let's start with the basics. This patient's a young guy who's already had two major surgeries on his chest.
Oh, wow. Yeah.
Yeah, and you can actually see it right away when you examine him.
Yeah.
He's got these bilateral thoracotomy scars. So that basically means he's had some sort of procedure done on both sides of his chest.
Hmm. Thoracotomy scars.
Yeah,
Yeah, that definitely tells us there's some significant stuff going on with his lungs, probably.
exactly. And it gets even more interesting when you listen to his lungs. He's got reduced breath sounds and reduced vocal resonance in both of the upper zones.
Okay.
Plus, he's carrying a salbutamol inhaler and has finger clubbing.
Oh, wow. Now, those are some really interesting clues. So the reduced breath sounds and vocal resonance, especially in the upper zones, that could mean that parts of his lungs have actually been removed.
Yeah, so if we put all of these pieces together, what kind of surgery do you think he's had? Not just once, but twice.
Well, putting it all together, the most likely thing is that he's had bilateral upper lobectomies, meaning they removed both upper lobes of his lungs.
Whoa, both upper lobes. That's a pretty major surgery.
Oh, yeah, it is. And to have this done twice, especially on someone relatively young, that really makes you think there's something unusual going on here.
Yeah, no kidding.
Yeah.
So why would somebody need a surgery like that? And what are the odds of needing it a second time?
Well, I mean, even one upper lobectomy is a pretty big deal. Usually it's done to take out a part of the lung that's diseased. Like if there's a tumor or an area that's just been really badly damaged, to have both upper lobes removed and then to be healthy enough for another surgery. It's not something you see every day, that's for sure.
I can imagine. So are we thinking like two separate lung diseases then? I mean, what could lead to a situation like this?
Okay, so the most likely scenario here is that he's had two primary lung cancers, one in each lung. And to be clear, to have had that second lobectomy, he would have had to be considered healthy enough for another major surgery, which is pretty remarkable in and of itself.
Okay, so lung cancer is looking like our prime suspect at this point. But before we go all in on that, are there any other reasons he might have had these surgeries?
That's a good point. You always want to consider all the possibilities. Um, if his chest exam had looked a bit more normal, we might have thought about maybe bilateral apical pleurectomies.
Bilateral apical pleurectomies. Whoa. Those are some big words. What does that even mean?
Basically, it means they take out a membrane that's around the top of the lungs. It's usually done to treat a recurring collapsed lung. It's also called a pneumothorax.
Ah, okay. So instead of taking out lung tissue, they're taking out a layer around the lungs.
It's exactly. Another possibility, especially if his exam was pointing more towards emphysema, could be bilateral lung volume reduction surgery, like a bilectomy.
A bilectomy. What is that?
So in a bilectomy, they remove damaged air sacs from the lungs. The idea is to try and help the person breathe better.
Okay, so we've got a few different surgical suspects lined up here. But considering his age, you mentioned he was relatively young. Wouldn't some conditions be less likely?
Oh yeah, absolutely.
Yeah.
Like, it's less likely that he would have needed surgery for something like complications from pulmonary tuberculosis, which is more common when people are older.
Yeah.
While tuberculosis can sometimes require surgery, these days it's usually treated with medication.
Okay, so it sounds like we're back to our original theory. Lung cancer seems like the most likely culprit, especially since he's had these two separate lobectomies. Now, you mentioned a few other interesting clues before the salbutamol inhaler and the finger clubbing. Let's start with the inhaler. What can you tell us about that?
Well, a salbutamol inhaler is often used to treat conditions like COPD. COPD stands for chronic obstructive pulmonary disease. It helps open up the airways and just makes it easier to breathe.
COPD. Now, that sounds familiar. Isn't that often linked to smoking?
You got it.
Ah,
And that's where this case gets really interesting. So we've got our patient with the salbutamol inhaler, which could point towards COPD, and he's also had two lobectomies, which could very well be due to lung cancer. And then we know that smoking is a major risk factor for both of these things.
okay. I see where you're going with this. The inhaler might be suggesting a smoking history, which would make lung cancer a lot more likely. So are we thinking smoking played a role here?
It's definitely a strong possibility.
Mm.
Now, just to make this medical puzzle even more interesting, we need to think about the type of lung cancer. There are two main types, small cell and non-small cell lung cancer.
So which one are we leaning towards in this case?
Well, the fact that our patient has had surgery twice makes small cell lung cancer less likely. Small cell lung cancer is usually treated with chemotherapy and radiation, not surgery.
Okay, so that means we're probably dealing with non-small cell lung cancer. But aren't there different subtypes within that category?
You're right. And considering the possible smoking history here, the most likely type would be squamous cell carcinoma. This particular subtype is very strongly linked to smoking.
Wait a minute, squamous cell carcinoma. I feel like I've heard that before. Isn't that a type of skin cancer?
You're thinking of squamous cell carcinoma of the skin, which is very common. But squamous cell carcinoma can also occur in other places in the body, including the lungs. And in the lungs, it's often tied to smoking.
Interesting. So we've gone from these mysterious scars and an inhaler to a possible diagnosis of squamous cell carcinoma of the lung, and it could all be related to smoking. This is why I love these deep dives. It's like solving a puzzle.
It is fascinating how all these seemingly unconnected pieces of information can fit together.
Absolutely. Now, before we move on, let's talk about that other clue you mentioned, the finger clubbing. You said it was significant, so what does it mean?
Okay, so finger clubbing is when the fingertips get bigger and the nails curve downwards. It can be a sign of chronic lung issues, and that includes lung cancer.
So in this case, the finger clubbing would support the idea that he's dealing with a lung problem, possibly lung cancer.
That's a good assumption. But it's important to remember that finger clubbing isn't only found in lung cancer. You can see it with other respiratory conditions too.
Like what?
Oh, there are a few. For instance, things like interstitial lung disease, chronic lung diseases like cystic fibrosis, lung abscesses, and bronchiectasis.
Wow, there are a lot of things that can cause finger clubbing. But taking everything we've discussed into account, lung cancer still seems like the most likely explanation here, wouldn't you say?
Yeah, I agree. Given the history of those bilateral upper lobectomies, the possible connection to smoking and the finger clubbing, lung cancer is still the most probable diagnosis.
Okay, so we've learned a lot about this guy's probable medical history, and we've explored how his potential smoking history might connect to lung cancer and those unusual surgeries he's had. But here's where things get really interesting. Are you ready for a real shocker?
Lay it on me.
Remember how we've been building this whole story around him possibly being a smoker?
Yeah.
Well, what if I told you this guy has actually never smoked a day in his life?
Wait, what? A non-smoker? You're joking.
No, I'm serious. This little detail was hidden way down in his medical records, almost like a secret clue. Turns out, he never smoked.
Well, this changes everything.
Mm.
We were so focused on smoking being the main issue, but now we need to rethink our whole approach.
Right, it's a total game changer. Now all our assumptions about smoking are out the window, and we're left with a brand new mystery. If smoking wasn't the main culprit, then what was?
Now, that is the million-dollar question. If he never smoked, what could have possibly led to 2 instances of lung cancer?
I don't know about you, but I am definitely intrigued. Let's take some time to absorb this new information, and when we come back, we'll dig deeper into this case. We'll explore what could cause lung cancer in someone who's never smoked. Stay tuned because things are about to get really, really interesting.
So we're kind of back at square one with this whole thing. It's like we've been given a whole new puzzle, but now we're missing some of the pieces.
Yeah, you're right. We went from this pretty straightforward idea, smoking leads to lung problems, to something way more complicated. We've got a non-smoker here who's had not one but 2 upper lobectomies, probably for lung cancer. What does that tell you?
Well, it tells me that lung cancer is not a simple disease. There's a whole range of things that can cause it. And yeah, smoking is a big risk factor, but it's definitely not the only one.
Okay, so if smoking is off the table, what else could be going on here? What could cause lung cancer in someone who's never smoked?
Well, genetics can play a part. If someone has a family history of lung cancer, even if they haven't smoked, their risk goes up quite a bit. Compared to someone without that genetic predisposition,
That makes sense. So are we saying this man might have inherited a gene that made him more likely to get lung cancer?
it's possible. But genetics isn't the whole story. Exposure to certain environmental toxins can also increase the risk of lung cancer.
Environmental toxins. What kind of toxin?
Radon is a big one. It's a radioactive gas that occurs naturally in soil and rock. It can seep into homes and buildings. And over time, exposure to radon can really damage lung tissue and make cancer more likely.
Radon. I've heard of radon, but I never realized it could be so dangerous.
It can be. And there are other environmental toxins too, like asbestos. Asbestos was used a lot in construction and insulation. And breathing in those asbestos fibers can lead to a specific kind of lung cancer called mesothelioma.
Wow, it's like there are all these invisible threats out there that we need to worry about.
That's true. And it's not always easy to say exactly what caused the lung cancer in someone who's never smoked. It could be a combination of factors, their genes, their environment, even a history of other lung problems.
Other lung problems, what do you mean?
Well, certain lung diseases, things like pulmonary fibrosis or COPD, can make someone more likely to get lung cancer, even if they've never smoked. It's almost like the lungs are already kind of weak or damaged, which makes them more vulnerable to cancer.
This is fascinating, but it's also a little scary. So many possibilities.
Yeah, and that's why it can be so hard to diagnose lung cancer in someone who's never smoked. It usually takes a really thorough medical history, a bunch of imaging studies, and maybe even a biopsy to know for sure.
Okay, let's get back to our patient. We know he doesn't smoke, and he's had two separate lobectomies, which means it's probably two primary lung cancers. What does that mean for his health, going forward?
Well, the fact that he's had those two surgeries means his lung capacity has been reduced, like significantly. He's lost two whole lobes of his lungs. That's going to make a big difference in his breathing and how much energy he has.
So even just simple things like walking or climbing stairs could be tough for him.
Absolutely. He might feel short of breath a lot, be tired easily, and have a hard time doing things that used to be easy for him.
That's a huge adjustment to make. What about his long-term prognosis? What can he expect down the road?
It really depends on several factors. The stage and type of lung cancer he's had, how well he responded to treatment, and his overall health. But having two primary lung cancers definitely makes things more complicated.
I can imagine. It's like he's already climbed a mountain twice.
Good analogy. And it's important to remember that it doesn't just end with surgery. He'll likely need to be monitored regularly, maybe have more treatments, and he'll definitely need a lot of support to manage everything that comes with lung cancer, both physically and emotionally.
You mentioned emotional challenges. What kind of impact can this diagnosis have on someone's mental health?
I mean, it can be a lot to deal with. There's the shock of getting the diagnosis, the anxiety of going through treatment, the fear that the cancer might come back. It's a roller coaster, for sure. And then there are the practical changes, having to live with reduced lung function, maybe having to give up activities, dealing with side effects. It can be tough, really tough.
So it's not just about treating the physical part of the disease, it's about taking care of the whole person.
Exactly.
Right.
A holistic approach is what you need. You have to address all of it, the medical stuff, but also the psychological and social and spiritual needs of the patient.
This whole deep dive has been really eye-opening. We started with this seemingly simple case, then we found out he's not a smoker. And now we're learning about all these different possibilities. It really shows how complex lung cancer can be.
It does. And it reminds us that in medicine, it's rarely just black and white. We have to be open to new information. We have to be willing to challenge our assumptions. And we have to be ready to change our approach as we learn more.
I totally agree. Before we wrap up this part of our deep dive, I want to bring up something you mentioned earlier. You said radon exposure can be a real risk factor for lung cancer, especially in people who don't smoke. What can people do to protect themselves from this?
That's a really good question. Now, I'm glad you brought it up. The good news is there are things you can do to reduce your exposure to radon. The first thing is to test your home.
Test your home. How do you even do that?
It's easy, actually. You can buy a radon test kit online or at a hardware store. The kit comes with instructions for how to collect air samples in your home.
Okay, and once you've got those samples, what do you do?
You send them to a lab. They'll measure the radon levels and give you a report with the results.
So let's say your radon levels come back high. What then?
If the levels are above the safe limit, there are systems you can install to reduce the radon in your home.
Systems? What are those like?
They usually involve putting in a vent pipe system. It basically sucks the radon gas from under your house and vents it outside, so it can't build up inside.
That makes sense. So getting your home tested for radon and getting a system put in if you need to seems like a pretty smart move to protect yourself from lung cancer, especially if you don't smoke.
It is. It's one of the best things you can do to lower your risk. And honestly, everyone should think about it, smoker or not.
This is really helpful information. I've got to admit I didn't know much about radon before, but now I'm definitely going to get my house tested.
I hope everyone listening will do the same. It's such a simple thing, but it could make a real difference. Now, before we move on to the last part of our deep dive, there's one more thing we need to talk about. We've covered the possible causes of lung cancer in non-smokers, but we haven't really talked about the emotional side of all of this, what it's like to be diagnosed with this disease. So when we come back, we'll talk more about that. We'll look at the importance of compassionate care and support for people who are facing this kind of life-changing diagnosis.
Welcome back for the last part of our deep dive into this case. It's been a wild ride, right? From that initial diagnosis to the surprise that our patient's a non-smoker. Now, I want to shift gears a little and talk about something just as important, the human side of it all.
Yeah, I think that's so important, and it often gets missed. We get caught up in the medical stuff, the diagnosis, and we kind of forget about the person at the heart of it.
Exactly. So let's talk about what it's like to be diagnosed with lung cancer emotionally and psychologically, especially for someone who's never smoked. I mean, you'd be thinking, why me? I've always taken care of myself.
Oh, absolutely. There's this feeling of disbelief, like your body's betrayed you. You start to question everything, your lifestyle, your environment, even your genes. It can be really isolating and overwhelming.
I can imagine. So what can we do for someone going through this? What can we say or do to help them cope?
Honestly, the most important thing is just to listen. Let them talk about their fears, their frustrations, their hopes. Don't try to sugarcoat it or give false hope. Just be there with them and acknowledge how they're feeling.
That sounds so simple, but so powerful. Just being present without judgment can make a huge difference.
It really can. And beyond listening, it's important to offer practical support too. Help them find resources, support groups, counseling places where they can connect with others who understand. Help them navigate the healthcare system, understand their options, make decisions, that kind of thing.
So it's about a holistic approach to care, taking care of the whole person, not just the disease.
Exactly. Treating the whole person. And recognizing that everyone's experience is different and needs a personalized approach.
This deep dive has been so insightful. We've looked at how complex lung cancer can be, the challenges of diagnosis, the unexpected turns it can take, and how important it is to be compassionate and provide whole person care. What are some key things you want our listeners to take away from this?
Well, first, I hope they understand that lung cancer can happen to anyone, smoker or not. It's crucial to know the risk factors, the environmental ones, and the genetic ones, and do what you can to lower your risk whenever possible.
That's a great point. The more you know, the better choices you can make about your health.
Absolutely. And second, I want listeners to really appreciate the human side of medicine. We're not just treating diseases, we're caring for people.
Hmm.
Their lives, their fears, their families. Being compassionate and empathetic can make a world of difference.
So true. And finally, I want to stress how important it is to stay curious and ask questions.
Yeah.
This case really shows how much we still don't know about lung cancer. We need to keep researching, keep exploring new ways to prevent, diagnose, and treat it.
Couldn't agree more. The more we learn, the better we can fight this disease and help those who are affected by it.
Well, I think we've covered just about everything there is to cover in this amazing case. It's been a journey, that's for sure, full of surprises and new insights. But more than anything, it's reminded us about the human element at the center of medicine and the powerful impact we can have on our patients' lives. So until next time, stay curious, stay compassionate, and keep those minds sharp.